Hey guys, so I thought I'd give you a little update on the emergency operating list or the CPOD list today. We are just waiting for our patient to come to theatre. We are doing a laparotomy, which means making a big cut on the top of the tummy to the bottom of the tummy. And this can be for a number of reasons, one of which is a hole in the bowel or what's called a perforation. It's really important to ensure that all patients having major, especially emergency surgery, are optimized as well as possible before the procedure. This is really important because one, it means that they'll do better intraoperatively during the procedure, and two, because they'll have better outcomes after the procedure. So what does this mean? It means making sure that we check their blood levels, and if needed, we transfuse them some blood before the procedure. If they're on any medication, that means that they're at high risk of bleeding and blood thinners especially, that we reverse the effects if we can. It means very close monitoring of things like sepsis and ensuring that we put into place all the management for this, especially fluids and so on. And it also means talking to our other team members, so having close relationships with the ITU team, the anaesthetists, the haematologists, us as surgeons, the medics if needed, and so on. And the most important is obviously informing the patient, the next of kin, if the patient isn't able to consent, and making sure that everyone's aware of what's going on. So the other roles that we have as a surgical team is one, to make sure that the patient's consented and ready to go. Two, to make sure the anaesthetist is aware and has seen the patient and is happy to proceed. Three, that we speak to the theatre staff, make sure they know what equipment to get out for the procedure and what to do and what to expect. Four, to make sure that we have booked the patient on the emergency list, make sure that we've spoken to our other team members who might be using this emergency list to let them know about delays and so on. And so lots of things to kind of tick off and make sure everything's done, but hopefully the patient will come to theatre and have the procedure done, and we hope that all goes well. So I'll keep you updated.